I am Dr. Arun Agarwala, Senior Consultant Dermatologist and Cosmetologist practicing in Apollo Clinic since 25 years. I am going to talk about fungal infection. Most of the time, patient with fungal infection does not take the disease seriously. They use native medicine like neem patta, suthol, Dettol, etc. and sometimes some irritant medicine like Darobin, Bitex, Jalim lotion, which leads to complete burning of that area, leading to thinness of the skin. So my sincere request to all the patients of fungal infection, they should consult to the qualified dermatologist, take the treatment properly in full duration and should have a proper follow-up. Thank you.
So many people, when they are on thyroid hormone replacements, they stop their thyroid hormone the day before or 1 or 2 days before the test to see what your thyroid is doing. My friend, whenever you are going to have a thyroid test, please take your medication as usual, because that is how we are going to decide whether we need to increase your thyroid hormone levels of medication or reduce your medication levels. So do not stop your medication before taking your thyroid test.
Hello, I am Dr. Meghali Devi. I am a senior consultant in Apollo Clinic Bora Service. I am practicing in Apollo Clinic since 2005. So in this period, mainly I have seen the most common problem the teenager or the adolescent girls are facing nowadays are the irregular menstrual cycle. That irregular menstrual cycle and the obesity is a very concerning problem for adolescent and teenager girls. So while examining by doing ultrasound, we have noticed that many of the patients they are having the endometriosis, means that endometrioma of ovary. So this endometrioma is nowadays very commonly seen in this certain group of patients. So it's a matter of concern for this problem nowadays, because endometrioma, there is collection of blood inside the mainly the ovarian endometrioma we have noticed. So that ovarian endometrioma, if we don't treat early, it may lead to infertility and other chronic pelvic pain in the future. So it's a very concerning problem nowadays the patients are facing. So I advise they should do regular clinical examination as well as ultrasonography routinely they should done, and if endometrioma is detected early, it should be treated early. Thank you so much.
Hello everyone, I am Dr. Meghali Devi, a consultant gynecologist in Apollo Clinic Bora Service for last 20 years. Today I want to speak a little about a common symptoms we encountered in day-to-day practice. Most of the patients nowadays, they come with vaginal discharge. I used to prescribe antibiotic along with antifungal. Patients who comes with that vaginal discharge, because sometimes that vaginal discharge it not only comes from the vagina but also from that eroded part of the cervix. So nowadays we routinely prescribe or routinely advise to take the patients who are between 9 to 45 years of age to take the cervical vaccines, because cervical vaccine is a single vaccine which can prevent that cervical carcinoma. Not only it prevents cervical cancer, but it can also prevent that oropharyngeal cancer, then genital, anal cancer and other vulval cancers also. Earlier that cervical vaccine cost was high, so patients were reluctant to take that vaccine. But as the price drops, nowadays we routinely advise and routinely ask the patients to consider taking that cervical, that human papilloma viral vaccines. Take that vaccine as early as possible. So thank you so much.
Hi, I've actually come for a TB test because I was applying for the UK visa, and then I got to know about Apollo Clinic in Bora Service, Ulubari. The service was really good. It was fast, really seamless. It didn't take me like more than 10 to 15 minutes to get done with the process. I feel the staffs are really professional out here, so I would definitely recommend you to come here and seek any kind of medical assistance that would be needed. Thank you.
Do you need a fast and accurate diagnosis? Here at Apollo Clinic, We understand that every second counts when it comes to your health. That's why we offer the latest technology and highly trained staff to provide you with the best care possible. Our CT scanner uses advanced imaging techniques to quickly and accurately diagnose a wide range of conditions. Don't wait any longer to get the answers you need. Contact us today to schedule your appointment and take the first step towards better health.
आज हम बात करेंगे कि दमा कैसे होता है। 50% ऑफ द केसेस दमा का जेनेटिक होता है। अगर किसी के घर पे पिताजी माताजी को या सिबलिंग्स को या भाई बहन को या ग्रैंड पेरेंट्स को एस्थमा है तो उस बच्चे को 50% चांस रहती है एस्थमा होने। और बाकी बहुत को एनवायरमेंटल एक्सपोजर होके धूल मिट्टी से या धुएं से या कोई चीज़ से या ठंडी से एलर्जी डेवलप होके एस्थमा हो सकता है। एस्थमा आपका कफ से या खांसी करने से या किसी के साथ बैठे रहने से नहीं फैलता है। एस्थमा ऑक्यूपेशनल भी हो सकता है, किसी को केमिकल फैक्ट्री में काम करने से भी सांस की बीमारी हो सकती है या जूट फैक्ट्री में एक्सपोजर होकर भी एस्थमा हो सकता है। और बहुत बार बाइक वगैरह चलाते हैं जो हेलमेट्स नहीं पहनते, मास्क नहीं पहनते, तो वो जो धूल मिट्टी जाती है उसकी वजह से भी एस्थमा का अटैक बढ़ सकता है और एस्थमा भी हो सकता है लॉन्ग टर्म। एस्थमा में अपन को खाने पीने में ध्यान रखना है, अगर किसी को किसी से एलर्जी है तो वो अपन को अवॉइड करें। धन्यवाद।
Coming to Larophilia, tunahan Apollo Clinic Ulubari akan oma kehi endometriosis patient kaniya MDV Dr. MDV Noya ka kaniya anni hi hey staff member ti kan fel emma chuanin kan doctor te po hi hey kan man lau chang te po in pata pachang te in an ko theya du huna message ang te po in an non theya an fel emma ni.
Colon cancer can also affect women, though the incidence of colon cancer in women is slightly lower as compared to men, but they definitely can have colon cancer. Regardless of gender, the incidence or the risk of colon cancer increases with age.